Today's video is going to be all about the position of the pelvis. So the pelvis is actually a really important part of posture because the position of our pelvis will affect the position of our entire spine. So most people tend to fall into one of two extremes when it comes to pelvic posture. The first one being an anterior pelvic tilt. So in this position, you can see I have a pretty exaggerated curve in my lumbar spine here, which is going to tilt our pelvis forwards. And these people usually have really tight hip flexors and tight muscles in their low back that can contribute to them staying in this position. The other extreme is a posterior tilt. So you can see that my pelvis is pretty tucked here. I don't have much curve in my low back. And in this position, it's pretty easy for me to just hang out on my ligaments. I'm not really doing much work or using my muscles to keep me up. And in that position, the pelvis tends to be leaning back just a little like this. So you're gonna wanna find a neutral pelvis position. So that's gonna be a little bit different for everybody, but in general, you're gonna be somewhere in between those two extremes. So you can kind of check your motion, mess around with what feels most comfortable for you. But for me, right about here is a good position. You can see I have a little curve through my low back, but it's not too much and not too little. And I can feel that my abdominals are engaged, but I'm not working too hard to stay in this position. You can also see that when I correct into this position, my posture up here gets better. So I'm definitely a person who slouches. I like to just let my shoulders fall forward and my head fall forward. But if I correct at my pelvis, it makes it a lot easier for me to stay in good posture up here in my thoracic spine and in my shoulders and my neck and head. So if you're having trouble finding a neutral pelvis, you should see a specialist such as a pelvic floor physical therapist.